Hello friends, welcome to my channel Simple Talk on Nursing. Today we'll see regarding the routes of drug administration. The drugs can be administered in different routes based upon the preparation. The labels in the container will give direction regarding the route of drug administration. The action of the drugs depends upon the route of the drug administered. So the drugs applied on the skin and the mucous membrane will take much time to give the desired effect. The drugs given through mouth will take some time for absorption. The drugs given by intramuscular route will act quicker than the oral route, and the drugs which is given by IV route act immediately after the administration and obtain the desired effect faster than any other routes. So today we'll see regarding the classification of the routes of drug administration. The firstly it is classified as enteral, parenteral and others. Under enteral it is oral and sublingual. Second one is parenteral administration under that subcutaneous, intradermal, intramuscular, intravenous, intraarterial, intraosseous, intrathecal or intraspinal, intraperitoneal. Others under which there comes inhalation, instillation, inuntion, insertion, insufflation, and implantation. Oral administration. It is the most common route and most convenient route for the client with least pain. The disadvantage of oral administration are their unpleasant taste and irritation of the gastric mucosa, and it will take a little more time for absorption, and some of the drugs have bad effects on the teeth. Secondly, sublingual administration. The drugs such as nitroglycerin are given sublingually by placing it under the tongue and letting it slowly dissolve. The next one, parenteral administration. Parenteral means giving the therapeutic agents or the drugs outside the alimentary tract. That means para means beside, enteron means intestine. Other than the oral cavity or the digestive tract, we are administering the medication. It is the type of administration accomplished by the help of needle and the syringe. The subcutaneous is also known as hypodermic. The administering of drug into the subcutaneous tissue. Skin and tissue should be free of abnormalities, not over a bony prominence, and free from large blood vessels and nerves. Intradermal, it is under epidermis into the dermis. The sites of intradermal injection is inner aspect of lower arm, upper aspect of anterior chest and upper aspect of the posterior chest. Nextly, intramuscular injection, administration of the medication into the muscles. The sites of intramuscular injection are dorsal gluteal site, ventrogluteal site, vastus lateralis site, and mid deltoid site. Intravenous injection, introduction of the medication into the vein. The medication which is given through the IV route act immediately and obtain the desired effect faster than any other route. Sites are cephalic vein, medial cubital vein, basilic vein, median cephalic vein. The angle of insertion of the needle is as shown in the picture. Intraarterial, it is the administration of the medication into the artery. Intraosseous, it is the administration of the medication into the bone marrow. Intrathecal or intraspinal, it is the administration of the medication into the spinal cavity. Intraperitoneal, it is the administration of the medication into the peritoneal cavity. Next, others, inhalation. Volatile drugs are given in this method. The client inhales the fumes into the lungs to have a local or systemic effect. Example, inhalation of the spirit ammonia to overcome fainting, or inhalation of the chloroform or nitrous oxide for their anesthetic effects. The next, instillation. Instillation is the putting a drug in liquid form into the body cavity such as urinary bladder or into body orifice such as ears, eyes or nose. Inuntion or topical application. It is the application of the drug to the skin, usually by the friction. Example, ointment. Many drugs are applied topically such as astringents, emollients, and antiseptics, etc. Insufflation, it is the administration of the drugs in the form of powder, vapor, or air into a wound or body cavity by blowing with an insufflator. In- Insertion, insertion means introducing solid forms of drugs into the body orifice. Example, suppositories are introduced into the rectum or vagina. Lastly, implantation. Implantation means planting or putting in of solid drugs into the body tissues. I hope you guys gained some knowledge through this video. Thank you for watching.